Nurse Nightingale. That is what Dr. Gabriel called her over the overhead page, his voice carrying across the entire trauma floor with the precision of a man who enjoyed an audience. Katie Morrison didn't flinch. She didn't look up from the cardiac monitor where she was mid-assessment on a patient whose oxygen saturation was trending downward, a 63-year-old construction worker with pneumonia and a fever that climbed another tenth of a degree every time she checked. The intercom crackled again. Nurse Nightingale to bed 7. Patient needs bedpan assistance. The words hung in the air like a challenge. Around her, 3 other nurses paused. Someone coughed. The fluorescent lights hummed their mechanical rhythm overhead, indifferent to the small violence of the moment. Katie finished entering the vitals into the computer. She documented the breath sounds, bilateral crackles at the bases, worse on the left. She adjusted the oxygen flow from 3 to 4 liters per minute and made a note to check back in 15 minutes. Then she stood, smoothed her scrubs, and walked toward bed 7 without changing her expression. She had been working the trauma ward at St. Michael's in San Antonio for 8 months. 8 months of being the most competent person in the room and the least acknowledged. 8 months of arriving at 6:06 a.m. and staying until 7:15 p.m. without complaint. 8 months of watching mediocre physicians take credit for her assessments and seeing her recommendations ignored until a male resident repeated them and suddenly they became brilliant ideas. Dr. Gabriel had been the department head for 12 years, and in those 12 years he had built a kingdom on a simple principle: control who looked good and you control who got promoted. Katie reached bed 7. The patient was asleep, the call button clutched in one hand. She performed the task without rushing, cleaned, changed linens, checked his foresight for any signs of infiltration. Her hands moved with the kind of efficiency that came from having done this 1,000 times before, in conditions far worse than a climate-controlled hospital room. The patient woke as she finished. "Thank you," he said. She nodded. "I'll be back in an hour to check your vitals." She didn't mention that his pneumonia was bacterial, not viral. She didn't mention that she suspected sepsis was beginning its slow crawl through his bloodstream, that the fever wasn't just an infection response, it was a warning. That wasn't her job anymore. Her job was bedpans and politeness. When she turned back toward the nursing station, Dr. Gabriel was watching her from across the floor. He was a tall man with the kind of silver-threaded hair that photographed well and a smile that never quite reached his eyes. His cologne preceded him like a boarder, something expensive that probably cost more than Katie's monthly rent. He was talking to the charge nurse, but his gaze tracked her movement through the ward. She could feel it the way you feel eyes on your back in a dark parking lot. But that wasn't the worst part. The worst part was the reason she was here at all, and why Dr. Gabriel's attention felt like a spotlight on a secret she couldn't afford to have exposed. The medevac alert came through at 3:22 p.m. Code trauma, inbound from Fallujah. Male patient, age 34, catastrophic chest injury with embedded shrapnel, thermal burns covering 40% of total body surface area, and an airway that was already showing signs of swelling from heat exposure. Katie was in the break room, eating a protein bar she'd forgotten about 3 hours ago, when the announcement blared through the speakers. She was moving before anyone else had registered the words. The trauma bay needed prep lines, fluids, blood products staged and ready, the kind of choreography that only happened when everyone in the room knew their role and executed it without waste. The medevac team came through the doors at 3:52 p.m. with a patient who looked like something that shouldn't have survived. The shrapnel was still embedded in his chest, they never removed it in the field if it was near vital structures. The burns had a leathery appearance, the skin blackened and contracted in the pattern of intense heat exposure. His breathing was already labored, each inhalation a visible effort. Katie saw him and something in her chest locked down. She knew this man. Not from St. Michael's. From Fallujah. From the forward operating base at Jolan District, from the field hospital where she'd trained 47 combat medics over 3 rotations, and this one had been exceptional. James Reeves. Commander James Reeves, SEAL Team 3, Charlie Platoon. He'd taken over her position when she rotated out. He'd been the medic who came in second shift, who asked the right questions about triage protocols, who understood that medicine under fire was about triage and ruthlessness and knowing which patients you could save and which ones you couldn't. He'd been a good medic. A great one. And now he was here, on a stretcher, with his airway closing and his burn spreading in blistered patches across what remained of his visible skin. Dr. Gabriel appeared beside her, already in motion toward the trauma bay. "Let's get him intubated," he said to the resident. "Full trauma workup. Someone page respiratory." He didn't look at Katie. He was already assigning tasks, already positioning himself as the hero of this particular story. "We're going to save this one," he said to no one in particular, the confidence in his voice the kind that comes from having never failed at something that mattered. The room moved around her, structured chaos, every person knowing their role. Katie moved with them, but she wasn't the lead nurse on this case anymore. That was Williams, the younger nurse who'd taken over after Katie's reassignment. Williams was competent. Just not as competent as Katie. She could see it immediately. The way Williams was setting up the laryngoscope, too hurried, not checking for the right blade size first. The way the resident, fresh out of his rotation, probably his first major thermal injury, was fumbling with the central line kit. She could see the problems before they materialized. But she didn't say anything. She just watched. Her job was bedpans. She was learning to be invisible again, the way she'd learned to disappear in Fallujah when her rank made her a target, when her presence in certain rooms was a liability instead of an asset. She grabbed supplies and handed them to Williams without being asked. Williams looked relieved. "Thanks," she whispered. Katie nodded and stepped back. That was when Dr. Gabriel's eyes found her across the room. He smiled. Not a warm smile. The kind that a predator smiles when it sees something small and wounded trying to hide. The evening shift change came at 7. Katie was finishing her notes when Dr. Gabriel found her in the supply closet, a narrow space lined with boxes of dressings and 4 supplies, dim lighting casting everything in shades of institutional beige. She didn't hear him come in. He moved silently, closing the door behind him with a soft click that seemed very loud in the confined space. "Impressive restraint today," he said. His voice was low, almost conversational. He stepped closer. Katie could smell the coffee on his breath, the expensive cologne, the antiseptic that clung to his white coat. Most nurses would have jumped at the chance to be in the trauma bay. Katie turned to face him. She didn't step back. Her expression was flat, not hostile, just completely empty of emotion. She had mastered this look in a place where any reaction was a vulnerability. "I was assigned to intake processing." She kept her voice level. Respectful. The voice of someone who knew her place. Dr. Gabriel smiled again, and this time she could see the satisfaction in it. He was enjoying this. The power differential. The fact that she was trapped in a small room with him and had no authority to object. "You understand the dynamics of this department, don't you, Katie?" He used her first name deliberately, the way a predator uses familiarity as a weapon. The nurses who succeed here are the ones who understand hierarchy. Who respect it. He took another step closer. She could see the flecks of gray in his jaw, the expensive watch on his wrist. "One more instance of overstepping your station, and I think you understand what that means, and you'll be terminated. Effective immediately. Nurses who forget their place don't last long under my watch." His voice was soft. Conversational. Like he was just making friendly conversation. Like he wasn't threatening her career in a supply closet with the door locked. Katie listened to him talk. She didn't blink. She didn't swallow hard or shift her weight or show any of the small physical tells that humans typically displayed when someone was asserting dominance. She just watched him with the kind of calm that came from having already survived things worse than this. When his speech finally sputtered to an end, when he'd exhausted his threats and was waiting for her to respond with fear or apology or capitulation, she spoke. Her voice was quiet. So quiet he had to lean in slightly to hear it. The difference between competence and insecurity is that one of them needs an audience. She turned back to the shelf and continued organizing supplies, her hand steady as they'd been on a dozen forward operating bases while rounds landed 2 kilometers away. The silence lasted 3 seconds. Then Dr. Gabriel left, closing the door behind him with more force than was necessary. Katie heard his footsteps in the hallway, heard him barking an order to someone about checking on the burn patient in the trauma bay. She didn't move. She just stood there among the boxes of sterile gauze and 4 lines, her jaw clenched, her hands very still, understanding with complete clarity that she had just made a decision that would either end her cover or end her mission. There was no middle ground anymore. And that's when the real nightmare began. The parking lot at St. Michael's at 7:42 a.m. was filled with the arriving day shift. 23 nurses, 4 physicians, 2 resident doctors, and 1 department head who was waiting for Katie Morrison by her car. Dr. Gabriel stood beside the hood of her 10-year-old Honda Civic like he owned the space. He was dressed in fresh scrubs, his hair combed, his expression composed. The other nurses arriving for shift saw him there. They saw Katie approaching. They watched. It was deliberate. He was making sure an audience existed before he spoke. Effective immediately, Dr. Gabriel said as she reached the vehicle, "You're being reassigned. Intake processing is no longer an appropriate fit for your skill set." His voice carried across the parking lot. Katie could count the nurses who'd stopped walking to listen. 14. Maybe 15. You lack the judgment required for critical care assignments. He paused, letting that land. Your lead nurse position is terminated. You'll be processing admissions only, no floor responsibilities, no access to critical care units, no exceptions. He smiled at the gathered crowd. Some people simply lack the judgment for critical care. 3 days. Intake processing. Forms sliding across a desk, patient names bleeding together, charts filed in alphabetical order while the ICU hummed behind locked doors she no longer had clearance to access. Katie's hands moved through the motions, check insurance, verify emergency contacts, log admission times, but her mind was 3 floors up in a burn unit where Commander James Reeves lay wrapped in antiseptic and gauze, his wound care assigned to nurses who didn't know the difference between first-degree and full-thickness burns, who charted vitals like they were filling out lottery tickets. The reassignment had been methodical. Gabriel had stripped her of lead duties by 0800, and by 0900 the duty roster bore his fingerprints everywhere, all the experienced trauma nurses suddenly assigned to different shifts, the ones who'd watched her save Reeves's life suddenly locked onto pediatrics and orthopedics. The message was written in scheduling code, isolation. She was competent enough to threaten him, so he'd made certain she'd never be competent again in his presence. Intake was a warehouse of humanity on the first floor, separated from the real work by elevator banks and hierarchies. A teenage girl with a sprained ankle. A construction worker who'd caught his thumb in a power drill. An elderly man with chest pain who'd waited 6 hours before his daughter finally drove him in. Katie processed them all with the same steady attention she'd given trauma patients in Fallujah, the same hands that had held tourniquets and administered push-dose epinephrine now scanning insurance cards under fluorescent light that hummed like a trapped insect. She heard the rumors. The morning shift gossiped in the break room, how she'd stepped beyond her scope, how she was being corrected, how Dr. Gabriel was absolutely justified in pulling her credentials. Nurses were supposed to follow orders, not override residents, not think they understood what complex cases required. The message circulated like a virus, Katie Morrison had overstepped. Now she was being taught her place. What they didn't know was that she'd already broken protocol twice to check Reeves's chart during her breaks. The first time, his infection markers were climbing and nobody had ordered blood cultures. The second time, his dressing note suggested the medical team wasn't monitoring for compartment syndrome, the pressure building inside burned tissue until it starved itself. Telltale signs were there if you knew how to read them. She knew how to read them. On the evening of day 3, she was processing discharge paperwork when something moved in her peripheral vision. A shadow of fear across a face. A tremor in someone's voice on the unit. That instinct, the one sharpened by 16 years in field hospitals and combat zones, registered a change in air pressure. Something was wrong. Something was happening upstairs. She didn't have to wait long. The code alarm screamed at 0200 hours, a sound like nothing else in a hospital, a sound that bypassed the brain and went straight to the nervous system. 3 short bursts. Then again. Code blue. ICU. Repeat code blue. Katie's legs moved before her mind caught up. She was on the stairs before she registered leaving the desk, her badge clipped to scrubs that had no authority in the ICU, her feet moving on muscle memory through corridors she wasn't supposed to walk. The code alarm meant someone was dying. The code alarm meant no security clearance mattered. She arrived at Reeves's room to find orchestrated chaos transforming into panic. The on-call resident, a young man named Patterson, couldn't have been more than 6 months past his boards, stood frozen with an intubation kit, his hands shaking as he held a laryngoscope. Reeves lay supine, his chest heaving, his face darkening from pink to purple. His oxygen saturation glowed on the monitor, 74. 68. 61. His closing, one of the nurses said, a note of desperation breaking through protocol. Airway swelling. The edemas. The tube won't pass, Patterson whispered. He tried again, the scope wavering in his trembling hand. The laryngeal view was gone. Swelling had crushed the anatomy. I can't, the anatomy's just. 57. 53. The numbers dropped like stones. Katie was already moving. She pulled a number 10 scalpel from the crash cart with her left hand and located the cricothyroid membrane by palpation, the small cartilage depression in Reeves's neck, the anatomical landmark between the thyroid and cricoid cartilage. Her fingers found it the way they'd found it in a sandstorm outside Fallujah, the way they'd found it in a village clinic with no anesthesia available. This was information. This was her language. She made the incision horizontal and clean, a 2-centimeter slice through skin and membrane. Blood welled. She didn't pause. The barrel of a ballpoint pen, the plastic housing, smooth and hollow, became an emergency airway. She passed it through the opening and Reeves's body responded immediately. The heave of desperation transformed into something else. Breath. Real, gasping breath. The pen barrel held. The oxygen saturation began its climb. 72. 80. 86. Pink returned to Reeves's face like sunrise, and for the first time in 40 seconds he wasn't dying. Get me a size for endotracheal tube and sedation, Katie said. Her voice was quiet. Nobody was sure afterward if she'd asked or commanded. 1 milligram vecuronium for paralysis. And someone needs to call the attending because this resident just learned that anatomy doesn't care about scope of practice. Patterson stared at the pen barrel. He was young enough that his entire understanding of medicine was being rewritten in real time. The 2 nurses exchanged a glance, the kind that said everything and nothing. Katie documented the time. 0203 hours. Emergency cricothyrotomy performed due to acute upper airway obstruction secondary to burn-induced angioedema. Patient response, immediate and appropriate. Oxygen saturation from 51% to 88%. Airway secured. She wrote it with the precision of someone who'd filled out field reports under fire, dates and times and clinical assessments that would hold up in any review. Then she turned and walked back to intake processing without speaking to anyone. At 0600 hours, Dr. Gabriel reviewed the incident report. His face went white, then red. Not red like embarrassment. Red like rage. Red like a man watching his constructed reality collapse. An on-call resident had needed supervision. That resident had received it. But not from Dr. Gabriel. From an intake processing nurse who wasn't supposed to be on the ICU floor at all. He made 3 phone calls before 0700. The first was to the State Medical Board, a colleague call questioning whether certain nursing credentials were obtained under entirely legitimate circumstances. The second was to the duty scheduler, requiring that Katie be reassigned to opposite shifts from all senior staff, eliminating any chance of mentorship or collaboration. The third was to security. With explicit instructions, Katie Morrison was restricted from accessing critical care floors effective immediately, pending investigation. By 0800, the isolation was complete. When she tried to check on Reeves that afternoon, citing concerns about wound dehiscence that she'd flagged in his chart 2 days prior, security was waiting at the ICU door. 2 officers. Polite faces that made clear this wasn't a negotiation. Gabriel appeared moments later, his voice dripping with institutional authority. Unauthorized patient contact violates hospital policy. Consider this your final warning. One more protocol violation and we move straight to formal termination. Katie looked at him without flinching. She didn't argue. She didn't defend her actions. She simply nodded and turned to walk away. But that wasn't the worst part. As she descended the stairs back to intake processing, she understood what had just happened. Gabriel's panic had crystallized everything. He hadn't called the board because she'd overstepped her authority. He'd called because she was competent. Because she'd saved a patient he'd already written off, because she'd proven his resident was incompetent, because somewhere in that hospital existed a wound that was getting worse while he systematically prevented her from treating it. Which meant the threat wasn't about her job anymore. It was about why someone wanted Reeves isolated from competent care in the first place. The retaliation started the next morning and didn't stop. Gabriel moved with the precision of someone who'd spent years accumulating leverage, and over the next 4 days, he weaponized every system available to him. The duty roster changed. Katie found herself scheduled exclusively with newly graduated nurses, RNs with 6 months of experience, still green enough to follow orders without questions, too junior to recognize when those orders violated standard protocol. The experienced staff who'd watched her save Reeves, the nurses who understood what they'd witnessed in that ICU, were scattered across day shifts, nights, weekends, rotations that never overlapped with hers. Erasure by scheduling. On Wednesday morning, Gabriel made his first formal call to the medical board. Katie didn't know about it until the chief nursing officer, Patricia Hernandez, called her into her office and closed the door with the careful quietness of someone preparing to deliver bad news. "He's questioning your credentials," Patricia said, sliding a printed email across the desk. Gabriel's words were measured, professional, weaponized with the language of bureaucracy. "I have concerns about the judgment demonstrated by Nurse Morrison during the Reeves case. The emergency procedures she performed, while they resulted in patient stabilization, were conducted without proper physician oversight or authorization. Given the lack of transparency in her background and the aggressive manner in which she's inserted herself into critical cases, I believe a full credentialing review is warranted." Patricia's hands were folded on the desk. She looked like someone caught between 2 fires. "Is any of that true?" she asked carefully. "No," Katie said. "Then we'll fight it in the review process." "But Katie, you need to understand, he's a department head. He has documentation. He has witnesses. And you?" Patricia trailed off, studying her. "You have a personnel file that's thin. No prior hospital experience listed. No references from previous facilities. Because there weren't any." Katie had created the civilian identity from scratch: birth certificate, social security number, a clean digital footprint stretching back 5 years. Nothing before that. Nothing that would survive scrutiny. That same day, Gabriel restricted her computer access. Not through a formal policy that would leave a paper trail, but through a casual conversation with the IT supervisor. Morrison's been accessing charts outside her assigned units, he'd mentioned during lunch. Can we limit her clearance to intake processing only? By afternoon, her credentials were downgraded. She could no longer view patient records without supervisor approval. She was a nurse who couldn't access the information that kept patients alive. The real damage came when Gabriel reassigned the witnesses. The nurses who'd been in the ICU that night, who'd seen her hands move steady as a surgical laser as she performed the cricothyrotomy, who understood that what she'd done wasn't reckless, it was the muscle memory of someone trained in trauma medicine, were systematically moved. One transferred to the pediatric ward on the opposite side of the hospital. Another was scheduled exclusively night shift starting immediately. A third was suddenly assigned to the outpatient clinic, pulled from the trauma ward entirely. Gabriel didn't have to threaten anyone. He just made them disappear from her orbit, made it impossible for them to corroborate her version of events if this ever went to a hearing. By Friday, Katie was functionally isolated. She worked surrounded by new graduates who saw her only as a slightly older nurse who kept asking them if they'd checked certain things on certain patients. She had no allies on her shifts. No one who'd witnessed what she could do. No one who could defend her if Gabriel decided to move from retaliation to destruction. But Reeves was still there. She saw the signs starting on the third day, small things that made her jaw clench with the kind of cold anger that came from knowing exactly what was happening. His dressing changes were being delayed. The sterile gauze on his anterior chest wall, which should have been changed every 12 hours, was going 18. 20. The skin edges around his wound line were beginning to separate slightly, the pink tissue beneath starting to weep fluid that meant infection was beginning its work. Dehiscence. The breakdown of a surgical wound. Common after burns when the tissue underneath hasn't healed properly, and it killed people in 72 hours if untreated because it opened the door for bacterial translocation straight into the bloodstream. Katie's break was 15 minutes. She used 7 of them standing at Reeves's doorway, ostensibly checking the monitor, actually running her eyes over his chest, his dressings, the subtle signs that the assigned nursing team was missing critical changes. Reeves was awake now, alert enough to track her, and she saw recognition flicker in his eyes, not recognition of her face, but recognition of competence, of the kind of assessment that meant someone actually knew what they were looking at. She didn't speak to him. She just made a mental note of the exact location of the wound separation and the fluid weeping from the junction, and she walked back to her station and filled out an incident report. Observing signs of early dehiscence on patient Reeves, room for 12, anterior thoracic wound, she wrote. Dressing intervals appear extended beyond protocol. Recommend increased monitoring and possible revision of wound care schedule. Early intervention indicated to prevent sepsis cascade. She placed it in the box for the charge nurse. Professional. By the book. Documented. Gabriel intercepted it before it reached Patricia. Katie watched him pull it from the box during his morning rounds, read it with eyes that went tight at the corners, fold it carefully in half, and place it inside the front pocket of his white coat. She saw him walk to his office and close the door. She knew, with the absolute certainty that came from 12 years of reading tactical situations, that the report would never make it to the medical record. That same afternoon, he called a meeting with Patricia and 2 people Katie didn't recognize, a man and a woman, both in suits, both with the kind of bearing that suggested hospital administration. They met in Gabriel's office for 45 minutes while Katie worked intake processing, checking patients in with the mechanical efficiency of someone whose mind was 3 rooms away. When the woman in the suit emerged, she was carrying a folder. Catherine Morrison. Her personnel file. They spent 40 minutes in the records office reviewing it. Katie watched from the hallway as Gabriel gestured to documents, spoke in the low tones of someone presenting evidence, while the 2 suits nodded and took notes. At one point, the man in the suit said something that made Gabriel nod with the grim satisfaction of someone whose strategy was working exactly as planned. The shift change came at 1900 hours. Katie was pulling a double, she'd volunteered for it, which meant she'd be there until 0700 in the morning, which meant she could check on Reeves at night when the nursing staff was thinner and her presence would be less notable. She'd already decided she was going to change his dressings herself if no one else did. Protocol violation. Insubordination. Unauthorized patient care. All of it documented, all of it worth it if it meant stopping an infection that would kill him. She was walking toward the break room when she saw security waiting at the exit. 2 of them. Standard hospital security uniforms, but they had the posture of people who'd been told to do something specific. One of them made eye contact with her and waited for her to approach. The fluorescent overhead lights cast everything in white, sterile illumination. The smell of antiseptic hung heavy in the air, mixed with something like anxiety, the electric tang of a situation about to break. Ms. Morrison. The taller one stepped forward. Yes. You're suspended, effective immediately, pending investigation into unauthorized patient contact and possible falsification of nursing credentials. We'll need your badge and your access card. Katie unclipped her ID badge from her scrubs without hesitation. She pulled her access card from her pocket and handed both over in one movement. No tremor in her hands. No negotiation. Just the kind of cooperation that came from understanding that pushing back right now would only confirm whatever narrative Gabriel had constructed. Your suspension is for a minimum of 2 weeks pending the investigation, the second guard said, reading from a sheet. You're not permitted on hospital property during that time. If you need to contact the chief nursing officer, you can do so by phone. Katie nodded. She walked out past them into the San Antonio evening, where the sun was dropping below the skyline and the temperature was still sitting at 84 degrees, and she didn't look back. The mission was collapsing. For 6 weeks, she'd been inside St. Michael's tracking a pattern that intelligence had flagged. Military medical records were leaking. Classified service details. Surgical records. Deployment histories. Someone on staff had access, someone with administrative clearance, someone who was selling information to a network that trafficked in military data. That network was connected to something bigger, something that involved targeting wounded operators for further exploitation, using medical records to identify vulnerabilities, exploiting PTSD diagnoses and pharmaceutical dependencies. Reeves was supposed to be bait. A critical patient, high value, exactly the kind of case that would draw interest from someone profiting off military data. Except Katie had saved his life, and in doing so, she'd blown her cover as a simple civilian nurse. The cover that was her only way to stay inside. The cover that kept her close enough to watch, to monitor, to intercept whoever was targeting him. She drove to the diner on Interstate 37, the one that glowed with the kind of harsh fluorescent light that made everything look like a crime scene. The parking lot was empty. Inside, a waitress with tired eyes and a name tag that said Denise poured coffee into a cup without asking, set it in front of Katie, and disappeared back into the kitchen. Katie sat in a corner booth where she could see both exits and the kitchen window. The coffee went cold in front of her. She stared at her reflection in the dark window and saw a woman with hollowed cheekbones and eyes the color of water at midnight. Behind the glass, beyond her own face, the interstate stretched away into darkness. Headlights moved like tracer fire in the distance. 12 years of operations. 3 tours. 47 commendations. 204 combat medics trained, including 1 Navy SEAL commander who was currently lying in a hospital bed with a separation in his wound that would kill him in less than 72 hours if no one intervened, and she couldn't be there to intervene because she'd been escorted out by security with a suspension letter and the kind of stain on her record that made her officially unreliable. What happened next would determine whether she'd failed a mission or whether she'd failed a man. The coffee had gone cold an hour ago. 3 a.m. at the Wayfarer Diner on Interstate 37, and Katie Morrison sat in a booth with cracked vinyl that smelled like diesel exhaust and old grease, staring at her reflection in the dark window. Not looking at it. Seeing through it. The glass showed her face but reflected nothing of who she actually was, just a woman in scrubs with dark circles under her eyes and the kind of exhaustion that comes from watching something you built collapse in real time. Outside, rain hammered the parking lot like applause for a performance that had already failed. She'd been pulled from St. Michael's at 0200 hours. Security escort, suspension letter, the works. Gabriel had orchestrated it perfectly, every move calculated, every restriction layered. He'd cut her off from Reeves, cut her off from the critical care floors, cut her off from the one place she needed to be. The duty roster was his kingdom now, and everyone on it knew not to talk to her, not to acknowledge her, not to let her near a patient chart or an ICU bed. The mission was collapsing. 12 wounded operators had had their medical data stolen and sold. Names, addresses, injury locations, family details, the kind of intelligence that made operators targets. The pattern pointed to someone inside the hospital, someone with access to records and the clearance to move through secure areas. Commander Reeves was supposed to be the bait. He was high-profile enough, high value enough, that whoever was running the trafficking ring would make a move. Katie was supposed to be watching from inside, documenting the contact, building a case that would lead to arrests and a dismantled operation. Instead, she was sitting in a diner watching rain streak the window like tears she refused to cry. Her phone buzzed at 0247. Unknown number. A text from one of the nurses she'd trained, one of the ones Gabriel had reassigned to the pediatric ward to break her network. Reeves crashing. Sepsis setting in. Gabriel refused transfer to ICU. Says he's stable. He's not. Katie's hand tightened around the coffee cup. BP dropping. Temperature spiking. The wound she'd documented 3 days ago, the dehiscence that the assigned nursing team had missed, was infected. Sepsis moved fast in burn patients, faster in someone with Reeves's level of injury. 72 hours. That's what she'd calculated. 72 hours before the infection would reach his bloodstream and turn into septic shock. 48 of those hours had already passed. She'd given Reeves a flag before he deployed. Her teammate's flag, folded tight, presented with the kind of gravity that only soldiers understood. She'd told him, bring it back clean. She'd meant come back alive. She'd meant don't let anything break you. She'd meant I trained you for this and you're going to make it. When he'd gotten hit in Fallujah, when the IED had turned his world into fire and shrapnel, he'd told the medics who dragged him to the aid station, get me Morrison's girl. The closer. She doesn't lose people. They'd called her that in Ramadi. The closer. Because when she opened a case, she finished it. 27 saves under fire. 27 people who'd walked out of that tent because she refused to let them die. Now she was sitting in a diner watching his death approach on a monitor she couldn't see, in a room she couldn't enter, in a hospital that had officially decided she was a liability. The rain picked up. Thunder rolled across San Antonio like artillery. She left $60 on the table and drove back to St. Michael's through weather that should have kept her home. The loading dock entrance was always less monitored, maintenance and supply deliveries, people moving through darkness without questions. Martinez was there, the veteran security guard, a former Marine who'd served under her in Fallujah. He saw her approach. He didn't move. He didn't acknowledge her. He just looked up at the camera, turned his body slightly so the angle wouldn't catch her face, and then looked away. Permission delivered in silence. Katie moved through the hospital like she'd moved through Fallujah, low profile, efficient, invisible to everyone who mattered. The elevator to the 4th floor took an eternity. The hallway was quiet except for the ambient hiss of ventilators and the soft beeping of monitors that didn't care about protocol or suspension letters. Reeves's room was at the end of the west corridor. The door was partially open. The night nurse, a young RN named Chen, looked up as Katie entered and relief flooded her face, the relief of someone drowning who'd just seen a hand extended from the water. Reeves was grey. Not pale. Grey. The color of someone bleeding out from the inside, his blood pressure tanking, his body shutting down as sepsis moved through his veins like a fire with its own intelligence. BP 80/40 and dropping. Heart rate 142. The monitor was screaming. The full line was running but it was wrong, too slow, the pressers weren't active, the cultures hadn't been drawn for sensitivity testing. How long? Katie's voice was steady, clinical, the voice of someone who'd done this intense with mortars falling outside. 3 hours, Chen whispered. Temp spiked to 104.2. Gabriel said it was normal inflammatory response to the burns. Said to monitor and report. Katie was already moving. She hung a second liter of normal saline, switched Chen's existing line to a rapid infuser, drew blood cultures from 2 sites before starting antibiotics, broad spectrum, high dose, the kind you used when time was the only currency that mattered. She started a norepinephrine drip and watched the monitor. BP response in 90 seconds. 85/42. Climbing. She debriefed the wound, documenting necrotic tissue that shouldn't have been there, signs of early cellulitis that someone had missed or ignored. Muscle memory. Her hands moved on their own, 14 years of field medicine translated into 18 minutes of precisely executed protocol. When she finished, Reeves's color had changed from gray to pale, which was the color of someone still fighting, still in the game. "Thank you," Chen said, but the words came out shaky, desperate. Katie didn't respond. She was already moving toward the door because she could hear footsteps in the hallway, boots on linoleum, the specific cadence of someone walking toward a fight they thought they'd already won. Dr. Gabriel appeared in the doorway at 0:45 hours. His face went through 5 expressions in sequence: confusion, anger, realization, fury, triumph. He'd caught her. After days of systematic dismantling, after removing her credentials and her access and her credibility, he'd caught her red-handed, violating the direct order to stay away from critical care floors. Security. His voice had the quality of a man who'd finally gotten what he wanted. "This woman is trespassing. She's suspended. She has no authorization to be in this unit." Katie finished checking the monitor one last time. Sinus rhythm. Pressure stabilizing. She looked at Chen and said, "Continue the protocol. 2 liters of fluid. Recheck labs in 4 hours. If pressure drops below 90, call for vasopressor adjustment." "Yes," Chen said, and the word came out automatic, respectful, the way people spoke to someone in authority. Gabriel heard it. His eyes narrowed. The security guards arrived, 2 of them, young, professional, doing a job they didn't understand. Katie didn't resist. She moved toward them with her hands visible, her posture non-threatening, the way someone moves when they know the fight is already lost and resistance would only hurt the people behind them. As they walked her down the hallway, she heard Gabriel's voice behind them, already on his radio, already building the narrative. Emergency Review Board. 5 a.m. Conference Room B. "We're going to destroy her." The loading dock had held the flag for 8 months. Bottom of her locker, beneath the spare scrubs and the old boots, folded tight the way Reeves had kept it in his pack in Fallujah. She'd told him to bring it back clean. He was going to. Now she had to make sure he got the chance. The hospital's routine background check for Katie's reinstatement hearing was supposed to be a formality, a box to check, a file to stamp, another suspension case moving through administrative channels. The review board had scheduled 45 minutes for the hearing, enough time for Dr. Gabriel to present his evidence of protocol violations and for Katie to listen quietly while her career was dismantled on paper. But the moment the background check processed at 0630 hours on the morning of the hearing, everything changed. The system flagged something buried deep in the federal databases, a classified security clearance, active and current, connected to a name that didn't match the nurse on file. The board administrator made a phone call. Then another. Then 3 more in rapid succession. By 0800, the reinstatement hearing was no longer a formality. Katie sat in the waiting area outside the conference room, hands folded in her lap, watching people in suits move with sudden urgency down the corridor. She dressed carefully, dark scrubs, her badge clipped to her pocket, the appearance of someone who'd done nothing wrong and expected to be vindicated. She felt the weight of the folded flag in her locker 3 floors below, tucked behind her spare shoes where no one would think to look. 48 hours ago she'd been escorted from this building by security. Now she was waiting to be called back in, and the voices behind the closed door had shifted from bureaucratic efficiency to something closer to alarm. She didn't flinch. She didn't shift in her chair. She just waited, and somewhere in the building, people who'd been sleeping 8 hours ago were now making calls to numbers that rarely rang during business hours. The door opened at 0847. The board administrator gestured her inside. The hearing room had changed. Where there had been 4 people behind a long table, the administrator, 2 HR representatives, and a hospital counsel, there were now 6. 2 additional people had arrived. One was a young Marine corporal in dress blues, standing motionless against the back wall with his cover tucked under his arm. The other was a veteran security guard who'd been at the hospital for 18 years, positioned near the door, his expression unreadable. Katie's breathing didn't change. Her heart rate didn't spike. She simply entered the room, took the empty chair facing the table, and waited. The administrator cleared his throat. Before we proceed with the formal review of your suspension, we've received some additional documentation that requires clarification. Corporal Martinez is here from the Pentagon Liaison Office. He has something to deliver. The young Marine stepped forward. His voice was sharp as a blade, formal and precise. Colonel Nightingale sends her regards. The room went so quiet you could hear the fluorescent lights hum. Katie's face didn't change. But the security guard, the veteran named Thomas who'd worked Fallujah before he'd transferred to civilian protection, his eyes widened just enough that anyone watching would have caught it. He stepped forward from his position by the door. He said, and his voice had shifted into something harder, more structured, the tone a person uses when addressing a superior officer. I didn't recognize you without the rank. But that's Colonel Katie Morrison. Silver Star recipient. The surgeon they called the closer because she never lost a patient under fire. He paused, and in that pause the entire room seemed to take a breath it didn't know it was holding. I served under your command in Fallujah. I salute you. His hand came up to his brow. The Marine corporal saluted a moment behind him. Katie nodded slightly, once, and both men lowered their hands. The board members exchanged glances like people watching a chess match they didn't know was happening. A laptop was turned to face the table. A video conference window opened, and a two-star general appeared on screen, his uniform impeccable, his presence carrying the kind of gravity that made the hospital counsel sit up straighter in his chair. Good morning. General Michaels, Joint Task Force 121, JSOC Coordination. I'm calling regarding Colonel Morrison's status and the circumstances surrounding her temporary reassignment. His eyes moved to Katie, a brief acknowledgement, then back to the board. Colonel Morrison's service record is as follows. 3 tours of duty in Southwest Asia. 47 commendations, including 2 Silver Stars, 3 Bronze Stars, and a Navy Cross. She personally trained over 200 combat medics for expeditionary medical operations. She has been specifically assigned to a joint task force investigating medical data breaches at Department of Defense treatment facilities. That assignment is classified, which is why it did not appear in her civilian personnel file. The general paused. Dr. Gabriel's interference with Colonel Morrison's work has compromised an active federal investigation. The hospital is now aware of this. I trust there will be no further complications. The door opened. A nurse wheeled in a portable monitor on a stand, connected by cable to a camera positioned in the ICU. The screen flickered to life, and Commander James Reeves appeared in frame, still healing, still bandaged, but awake and present. His voice was rough from the endotracheal tube that had been in his throat 72 hours ago, but every word carried weight. I need to say something. She gave me her teammate's flag before I deployed to Fallujah. Told me to bring it back clean. Told me the standard I had to meet. When I got hit, when the blast came, I saw her face. Not my company's. Not my team's. Hers. And I knew I wasn't allowed to die. Because she didn't train people who quit. And she wouldn't let me be the first. He coughed, swallowed, continued. Everything she did for me, everything she's done here, it's what Colonel Morrison does. She closes cases. She saves lives. The fact that you tried to fire her for that is something you're all going to have to live with. The camera feed cut. The room sat in silence. The board administrator opened his mouth, closed it, opened it again. Before he could speak, a phone rang. Then another. Then 2 more simultaneously. The board members checked their devices. The hospital counsel's face went pale as he read the incoming message. The administrator's phone buzzed repeatedly, calls from the hospital communications department, from the CEO's office, from news outlets. Dr. Gabriel is being requested for a live television interview, someone said quietly. A local news station wants him to discuss his allegations. They're going live in 2 hours. Katie's jaw tightened slightly, just enough that Thomas noticed it. But she said nothing. She simply waited as the board members scrambled, as the Marine corporal placed a letter on the table in front of her, as the general's image remained on the screen, watching with the expression of someone who'd seen this pattern before and knew exactly how it would end. The administrator looked at Katie. "Your reinstatement is approved effective immediately. Your back pay will be processed within 5 business days. You're cleared for all duty assignments." He paused. "And Colonel Morrison?" "We're sorry." She nodded once and stood. The new studio in San Antonio occupied the 8th floor of a glass building downtown, all morning light and professional makeup and the kind of controlled environment where people believed they could shape narratives with the right words and the right lighting. At 1,700 hours, Dr. Gabriel sat in the guest chair, his tie perfectly knotted, his hair precisely styled, his confidence radiating like heat off asphalt. The anchor smiled at him, sympathetic, understanding, the expression of someone on his side. She asked about difficult decisions. About maintaining standards. About the necessity of protecting professional boundaries. Gabriel expanded, spoke about protocol violations, about a nurse who'd repeatedly overstepped her authority, about the responsibility of medical leadership to maintain the integrity of their departments. The audience watching the live stream grew, 200,000, 400,000, approaching 6 million as the clip began circulating before he'd even finished speaking. Then the anchor touched her earpiece. Her expression shifted. Not dramatically, it was too professional for that, but enough that Gabriel's confidence faltered for a moment. "We have a caller on the line," she said. "General, thank you for joining us from the Pentagon." The screen split. The same 2-star general from the hospital video conference appeared, and his eyes found Gabriel with the precision of a target acquisition system locking onto heat. For the next 8 minutes, the general dismantled him sentence by sentence. The credentials Gabriel had questioned were classified military records he had no clearance to even know existed. The unauthorized patient contact was a decorated combat surgeon monitoring a patient whose care was being criminally neglected. The falsification accusation was defamation against a federal agent on active assignment. The general then read a list: Gabriel's reassignment of every staff member who'd witnessed Katie's competence, his alteration of duty rosters, his restriction of her access to critical care, his refusal to transfer a septic patient to a higher level of care, and asked if the medical board would like copies of the documentation. Gabriel tried to interrupt. The anchor cut him off. The general continued, his voice steady as a metronome marking time toward judgment. Dr. Gabriel's interference compromised an active investigation into medical record trafficking targeting wounded military personnel. His negligence nearly killed a Navy SEAL commander. His ego put dozens of operators at risk because he couldn't tolerate being outmatched by a woman. The general paused. The silence stretched across the television screen, across the live stream, across the city. I'd be very interested to hear what his next employer has to say about this interview when they run his background check. The live stream went viral in 12 hours. 6 million views. Comments multiplied faster than the moderation team could delete them. News outlets picked up the story, local first, then regional, then national by morning. Dr. Gabriel's morning began with his phone ringing at 0530 hours. The hospital's CEO calling. Administrative leave, effective immediately. Then the medical board, requesting his presence at an emergency hearing. Then his attorney, advising him that 3 former employees were asking about pursuing civil action for professional sabotage, and all 3 were women, and all 3 had documentation. By noon, the board had issued a preliminary finding: Dr. Gabriel's medical license was under immediate review pending investigation of professional conduct violations. His allies, the senior physicians who'd supported his version of events, who'd made calls on his behalf, began returning his messages with increasingly curt brush-offs. A colleague who'd socialized with him for 15 years suddenly had scheduling conflicts. A hospital administrator who'd backed his decision sent word that they were distancing themselves from his actions. By the end of the week, Gabriel had resigned. He sent an email to the hospital at 2,200 hours on Friday, claiming medical reasons, citing personal circumstances, offering no explanation that explained anything. the hospital accepted the resignation at 0600 hours on Saturday and removed his name from the directory. He applied for positions at 3 hospitals, all 3 rejected him after running background checks. By 6 weeks, he'd found work at a strip mall animal clinic in a suburb of San Antonio, processing intake paperwork for rescue animals, his name tag reading simply Gabriel, his salary a fraction of what he'd earned, his authority reduced to asking people if their cats had been vaccinated in the past year. He came home each evening to an apartment he'd stopped inviting people to, and he watched the view count on the general's interview tick upward toward 10 million. 6 months later, Katie stood in dress uniform beside Commander James Reeves at his promotion ceremony. His dress blues were immaculate, the new captain's bars gleaming. He'd trained the next generation of SEALs over the past months, was being advanced for valor in Fallujah, for leadership under fire, for the kind of steadiness that inspires men to follow you into the worst places on earth. The ceremony took place at Naval Base San Diego, in a room full of officers and enlisted personnel, commanders and junior sailors. Reeves gave a short speech. He thanked his team. He thanked the medics who'd kept him alive in the field. And then he said, "There's someone I need to acknowledge. A surgeon who taught me that the standard is higher than you think it is. That competence isn't something you announce, it's something you prove. And that the quietest person in the room might be holding it all together." He paused. "Colonel Katie Morrison, thank you for not letting me quit." The room came to attention. Katie stood at ease, her face composed, her hand steady. After the ceremony, she and Reeves walked out to the parking lot under a California sky so clear you could see the edge of the world. He asked her a question. "Do you regret it? Not defending yourself earlier? Not exposing him the second he started?" Katie shook her head. "People who need an audience for their competence usually don't have any," she said. "The ones who matter already know who you are." She drove back to San Antonio that evening. The highway stretched out empty, the kind of drive you make alone with your thoughts. She arrived at St. Michael's at 20:45 hours, changed into her scrubs in the locker room, and placed the folded flag back into its place behind her shoes, the flag from her teammate, the flag Reeves had carried into Fallujah and brought back clean. The trauma ward smelled like antiseptic and floor wax. The fluorescent lights hummed their mechanical rhythm. A new batch of residents watched her move through patient assessments with hands that never shook, with a presence that made the air pressure change, with the kind of calm that comes from having already survived the worst. One resident asked where she'd learned to work so efficiently in a trauma setting. Katie didn't answer. She just checked the next chart, reviewed the next labs, moved to the next patient. She was still there when the sun rose. She was still there when the day shift arrived. She was still there because that's what the closer does. The investigation into the medical records trafficking ring continued. The 12 operators were safe. The trafficking network, a records clerk named Morrison with gambling debts and access to federal databases, was now facing federal charges. And Katie Morrison worked nights in the trauma ward of St. Michael's in San Antonio, closing every case she opened, holding the standard so high that no one who trained under her ever forgot what competence actually looked like. The mission continued. Because that's what warriors do. If you made it this far, you know the difference between a boss and a leader. Subscribe, because we're telling these stories every week. Drop a like if you believe in the quiet ones. And comment, what would you have done in Katie's position?